Hello and welcome everyone to another session of Zomeo Classroom. I am Dr. Neha Khorke and today we will be discussing a very different case. Today we will be touching upon a topic that most homeopaths are hesitant to practice with, and that is acute fever. Generally, when it comes to any type of acute disease, a homeopath first thinks whether the homeopathic medicine that he will be giving will work on time or not. But let me assure you that if you give the right remedy, then all your cases can be resolved successfully, even fevers. Let's see how we solved this case of fever with Zomeo. This is the case of a retired female doctor, 62 years of age, who reported to us for treatment with the following complaints. She had been suffering from recurrent renal stones in both kidneys since 5 years, mostly painless episodes. She gets at the very least 2 attacks of urine infection every year. Currently, she is suffering from UTI since a week, but she is tired of taking any antibiotics. Let us look now at the origin, duration, and progress of her complaints. Chills that come on every evening, followed by fever. Before we continue with the case, let me first tell you, please take a notebook and a pen and note down all the symptoms that you feel are characteristic. Alright, let's continue. So, we were at chills that come on every evening, followed by fever. The temperature usually does not go beyond 101 degree Fahrenheit. The fever usually comes down on its own without any episode of sweating. But she is complaining of weakness that is intensifying every day. Now, in the chill stage, the chill is felt more in the abdomen and head, wants to cover her entire body because uncovering brings on chills. There is a dryness in the mouth with difficulty to talk and no desire to take any water. She feels that the chills increase whenever she is drinking water or while urinating. Now, this chill is followed by heat in the night. She feels thirsty and wants to take warm water. There is no desire to have any food and there is burning in her stomach. So we see that there is an episode of chill or a phase of chill, and that is followed by heat and fever. She feels thirsty. Like the chills, the heat is also felt more in the abdomen. Lips become dry, constipated since a week, which means that she is constipated since her fever has begun. She feels like going to the washroom, but there is scanty and hard stool. Temperature not more than 101 degree Fahrenheit. Urine is also scanty and there is painful urging. There is no sweat stage. By the early hours of the morning, the temperature comes down, but there is still the frequent painful urging to urinate and the digestive problems persist. So this was the phase of her fever in 3 stages: chill, heat and sweat, which is absent. Now let us go back into her previous history. Every previous attack was treated by antibiotics. Now with relation to the calculi are small, less than 8 millimeters, and they are located in the kidneys. As a result of consuming antibiotics, she has developed severe acidity, and so is not able to eat any spicy food. 2 years back, she switched to bland foods, but now since a year, even the bland food is causing acidity. 18 months back, she was diagnosed with a duodenal ulcer. She is a known case of hypertension, which is controlled by allopathic medicines, but now she is also taking Ayurvedic medicines. So if you see her overall constitution, it is a constitution that has been abused by a lot of allopathic medicines, especially antibiotics. Her constitution has also endured Ayurvedic medicines. Personal history. She has retired 7 years back from her government job. The husband is a retired engineer. She has 2 children who stay abroad with their family and they visit her frequently. Okay, now this was the case history. I hope you have taken down the points that you felt were characteristic in this case. But what we need to really understand is, firstly, can homeopathy control the fever? If yes, what approach do we apply? And the third, do we tackle the fever or do we tackle the fever along with the chronic complaints? How do we go about solving this case? Now, the resolution for this case can be found in aphorism 243 of the Organon of Medicine, written by Samuel Hahnemann. Let's see what he writes. In those often very pernicious intermittent fevers which attack a single person not residing in a marshy district, we must also at first, as in the case of acute diseases generally, which they resemble in respect to their soric origin, employ for some days, to render what service it may, a homeopathic remedy selected for the special case from the other class of proved or not antisoric medicines. But if, notwithstanding this procedure, the recovery is deferred, we know that we have sora on the point of its development, and in that case, antisoric medicines alone can effect a radical cure. So the solution that has been given is that first, we tackle the acute symptoms or the acute complaints for which the patient has come. Since we know that this is a recurring case which classifies it eventually as a chronic disease, we must tackle this as a chronic disease later because she will be needing anti-miasmatic medicines. As of now, to clear the picture, we will be tackling her fever first. And that is how we proceed. We treat first the acute phase of the fever. Once this abates, we need to take a detailed case history to prescribe the correct constitutional and anti-miasmatic medicine. The next question that comes in is, what approach do we apply? If you remember, in one of our previous sessions, we had discussed about Boger Bonninghausen's characteristics and repertory. I refer back to this repertory because this repertory has very detailed chapters on fever and the different stages of fever. So right now we will be going in with Bonninghausen's approach for treating this case of fever. When we look at working out with the totality, we know that the fever is there in different stages. And that is why we need to take up the characteristics of every stage of fever, finally coming to a remedy that is able to cover all of these characteristic features in its various stages. We look at the characteristic symptoms of fever in this case. Now in the chill stage, this is what we saw. Chills felt more in the head and in abdomen. Chills that characteristically came on only in the evenings. Chills were more when drinking water as well as while urinating and while removing the covers, and lips became dry during the chills. So how do we interpret this using BBCR? So chills felt in the head gets a characteristic based on its location. In the BBCR, you will find this under partial chill. The same applies for chill felt in abdomen. Chills in the evening is characteristic for its periodicity and time modality, whereas chills aggravated drinking water, urinating, and when removing the covers fall under the characteristic aggravating modalities that are given very high importance by Bonninghausen. And the last is a concomitant where the lips become dry during chills, which is why we have taken these 7 symptoms as characteristic in our patient, and we will be then repertorizing these as well. This was in relation to the chill stage. Moving on to the heat stage, we know that there were certain characteristics in the heat stage as well. They were heat felt more in the abdomen, heat coming on at night, aversion to food during fever, nausea during fever, burning in the stomach during fever, frequent painful urging to urinate, scanty urination, and dry lips. So we see that these are the characteristics in the heat stage. Again, if we typify them using the Bonninghausen approach, we see that heat felt in the abdomen is again a location which is a partial chill. Heat coming on at night is a time modality. We do not have any aggravating or ameliorating modalities in the heat stage of the fever, but we do have 6 concomitant symptoms, including aversion to food, nausea, burning in the stomach, painful urging to urinate, scanty urination, and dryness of lips. So now, how do we consider all of this in our totality? Let's start recording the rubrics and see what we get. Alright, let's start recording these rubrics now. Since we have applied the Bonninghausen approach, we will be only using the BBCR to record the rubrics and to finally arrive at the remedy. Looking for rubrics in the BBCR is a little bit difficult for most homeopaths because they are used to the Kentian approach. And that is why I will be teaching you a very simple way in which we can look for rubrics easily. All you have to do is press Command S from your keyboard. Once you press this, a pop-up window opens in which you just type in the keywords of the rubric that you are looking for, and you get the results from all the repertories. From all the repertories, we will only be looking at the results from BBCR. Now the first symptom that we need to search for are chills in the head. So I just type chills space head and I press enter. Now I have got 721 references, but what I am looking for are only those references from the BBCR. So I select Boning, which is the abbreviation for BBCR, and here I see all the references for chill in the head, starting with concomitants. However, that is not what I'm looking for. What I want is the second rubric in the head, which is Bonninghausen chill, partial chill head. This is the exact rubric I am looking for, and I will record it by just checking the box. It's done. The next rubric I am looking for are chills in the abdomen. Again, Command S from the keyboard and I type chills abdomen. Enter. I see 344 results. I click on Bonninghausen, which has just 17 references, and I select the fourth option in the list, partial chill abdomen on. Check the box and it is recorded. The next rubric is chill in the evening. So this is a time modality. Very simple again. Command S, chill, space, evening. I click on Bonninghausen where there are only 2 references. Now, if you see the references of the complete repertory, for chilliness in the evening, there are 233 references. Comparatively, if you see in Bonninghausen, the references are much more concentrated. Okay, so we have 2 references with 96 remedies in the first one. That is what we will take. Bonninghausen, chill, time, evening. Check the box and it's recorded. Moving on to the aggravating modalities in the chills. We had chills, aggravated drinking water, urinating, uncovering. So we will be searching for these rubrics now. Command S, we put in chills, drinking. Enter. If you click on Bonninghausen, we have 7 references, 3 for aggravation and 1 for amelioration. We will be taking up the first rubric, chill, aggravation, drinking. Select and it's recorded. The next rubric we have to record is chill during urination. So we'll type chill space. Now understand that the language in BBCR and in Kent and in other repertories is slightly different. So if we type urination in Kent, in Bonninghausen, it will be urinating. So we'll type urinating. And we get 4 references from Bonninghausen, and we are going to take the second reference where it is Bonninghausen, chill, aggravation, urinating while. There are other rubrics as well, urinating after, urinating before. We will be taking up urinating while. You select it and it's recorded. The last aggravating modality in the chill phase is chills aggravated uncovering. So Command S, chills uncovering. In Bonninghausen, there are only 2 references and only 1 for aggravation uncovering undressing. We will be selecting that. And now, since we have completed with the aggravating modalities, there is only one concomitant in the chill stage where the lips are dry. And again, we will be recording that using the Command S feature. So, Command S, chills, lips, dry. Just one reference in Bonninghausen, chill, concomitants, lips, dry. recorded. So now we have recorded all the rubrics for the chill stage. Let's have a look at the repertorization sheet with these symptoms alone before we record the symptoms of the heat stage. So I click on the first icon in the black taskbar, and here is my repertorization sheet. According to the totality, Nux vomica is the top remedy, followed by arsenic and then China. If I click on symptoms covered to see which are the remedies that cover the maximum number of symptoms, again I see that Nux vomica is there at the top of the list, but this time China has come second, followed by arsenic. We still have a few more rubrics to record. Those are the ones from the heat stage, and these we will record directly from the BBCR repertory using the classic method. To do this, you can either just press Command O from your keyboard, or from the repertory module you click on repertory list. And now we see the list of repertories with their chapters on the left hand side. What we are specifically looking for is the BBCR, and in that we are looking for the heat stage of fever. So instead of scrolling down the entire list, in the search bar I just type heat. And now under Bonninghausen, I see the chapter Heat and Fever in General. And now I can start recording rubrics from this chapter. The first rubric I need to record is heat felt in the abdomen. So all you need to do now is just start typing heat space abdomen. And now if you see the first reference that comes, partial heat abdomen. This is the exact rubric we are looking for. You can either record the rubric by checking the box here itself, or if you would like to see the remedies under that rubric, just click once on the rubric and the software directly jumps to that rubric in the heat and fever chapter. You can record the rubric from here itself. So we record the rubric here. So heat, partial heat abdomen has got recorded. The next rubric we want is heat or fever that comes on at night. So again start typing heat night. And you can see the first rubric time night. Again, this is the exact rubric we are looking for. We will check the box and the rubric is recorded. Going on, we have aversion to food during fever. Now all of these other rubrics that I am going to record are concomitants. You can directly start typing. Let's type heat space food and see the references that we get. We have three references. The first is concomitants, appetite, repugnance to food. And the second is concomitants, appetite, aversion to food in general. This is what we are looking for. In the BBCR repertory, a lot of the rubrics are given in the patient language. So it makes it easier for the physician to understand and to differentiate between two rubrics and finally decide which is the one that he wants to record. So we record the second rubric, that is concomitants with aversion to food. The next rubric is nausea during the fever. So again, I only type nausea and it comes under concomitants. Now interesting, in this list, we have a lot of sub rubrics. So we have queamishness in general, vomiting in general, vomiting bitter ingesta of, what we are looking for is the first one, queamishness, which is an old world word for nausea. This is what we will record. Again, it's recorded very easily. The next is painful urging. So if you remember, the urination was painful during the heat stage. We look for, okay, so the moment I type painful, in this chapter there are only 3 references for painful. The first, concomitants, urination painful, concomitants, gums painful, heat and burning painful. I want the first rubric. Instead of recording it directly from here, let me just see where this rubric is and how it is represented. I click on it and I see that there are 10 remedies under urination painful during fever. If you see, Nux vomica is featuring here as well. But in the end, we need to see where it figures in the final repertorization sheet. Let's record this rubric. The next is scanty urination. Again, typing scanty gets me just one reference in the entire chapter, which is for scanty urination, again with 10 remedies, and I record it. And now the last and final rubric of the heat stage, also the last and final rubric of the entire totality, which is dryness of lips. We'll record it again, dry, lips. And we have one reference, concomitants, lips, dry. We record it. And now we have successfully recorded all the symptoms of our totality in our repertorization sheet. Remember that this totality is quite long because it has a lot of characteristics and we do not want to miss out on anything. Let us look at the final repertorization sheet. So, in the final repertorization sheet also, Nux vomica is coming out on top. It is the first remedy in the list that is on top as per totality as well as symptoms covered, because it is the only remedy in the entire list of remedies which is covering each and every rubric. And that is the beauty of BBCR. So it gives you very targeted result. It will give you just 1 or 2 remedies that will cover all the rubrics, and then you are sure that this is the remedy for your patient. Now, if you look back, Nux vomica also as a constitution has a history of drug abuse or abuse of allopathic drugs. If you really want to see, we have a beautiful rubric in Phatak repertory. Let's go through that rubric. Let's press Command S and I type just drugs. Let me have a look at the reference from Phatak. Why I am insisting on Phatak is, again, it is a very concise and very precise repertory. So it will give us very targeted results. So now in this, if I see drugs abuse of in general, clicking on it, I see that Nux vomica is the only 3-mark remedy in this rubric of 15 remedies. So such a history is found in Nux vomica as well. Plus the gastric and the digestive symptoms of constipation and burning in the stomach are also covered by Nux vomica. Now if you recall our case of fever, this woman has also stones in the kidneys. Do we know whether Nux vomica covers this as well? Let us have a look. So this is just for academic interest that I am telling you. Let's look for renal calculi in our repertories and see if it is well represented by nux vomica. Again, we go to command S and we type renal calculi. Alright, so we have 17 references for renal calculi. Let's look at the reference from complete repertory. We see the remedies in the complete repertory and we do see that nux vomica is featuring as a 3-mark remedy for renal calculi. So we know that apart from the acute phase of fever, nux vomica could also take care of the renal stones if the symptoms corroborate at the end of the fever. Now, so we know that nux vomica now is the remedy because BBCR has given that it is the only remedy that is covering all the symptoms of the fever. But you know, when it is a case of urinary tract infection, it's not just the medicines that will work. You will also have to give a lot of auxiliary and ancillary measures to this patient to get better. So you will have to give him do's and don'ts, and you will also have to give him instructions with relation to food and water. Now, what are those instructions and how can you give them? In our utility section, we have two very important features. One is patient instruction and the second is diet and nutrition. You can use the sections of patient instruction and diet and nutrition to give the auxiliary and ancillary measures to your patient. Let me show you. Starting with patient instructions from the utility module, there are more than 600 clinical conditions for which we have specific do's and don'ts in Hompath Zomeo. Let's see for UTI or urinary tract infection. So I type in UTI and now here I can see in short the details about what UTI actually is and the do's and don'ts for UTI. This can be printed out and given to your patient as well. Now this is very essential because if you do not give instructions for do's and don'ts to the patient, you will have at least one maintaining cause which will prevent your medicine from acting well. Okay, so these are the do's and don'ts. Another important measure that you need to give to your patient is with relation to his diet. So for diet, again, we click on utility and we have a section on diet and nutrition. Again, like in patient instructions, I'll just type the condition that I am looking for. Now in this, I have the do's and don'ts for kidney stones. So this is again essential because the kidney stones are what are actually responsible for the UTI. So now we have information about the kidney stones, right from the causes to the signs and symptoms, and finally the diet management. How much of water should a person have in the entire day? What are the foods that he should be having? What are the foods that he should be avoiding? All of these are very important when it comes to managing diseases in the body. It is a combination of the right medicine, the right do's and don'ts, and the right food or diet which will work together in favor of the patient and help her get better faster. So these are the diet and nutrition and the patient instructions that you can use. Okay. For our academic interest also, if you would like to read up on fever and the therapeutics of fever, we have a lot of good material available in the form of reference books. I'll just show you one example. If you click on reference books from the books menu, on the left hand side you can see all the books of the different categories that we have in Zomeo. If you are looking for a specific book, all you have to do is just type one of the words or few of the letters of those words in the search box and you will find the result. What I am looking for is The Prescriber by Clark. So I'll type prescriber, and what I'm looking for is The Prescriber by John Henry Clark, which is there in the therapeutics section. Now Clark again is one of our old stalwarts or pioneers of homeopathy who gave very specific instruction for different diseases and how to treat them. Now in this, let us see what he has written about intermittent fevers. So in the chapter section, I go to I. So the chapters are categorized alphabetically. I go on to I, and in the section, I click intermittent fever. So now I have directly jumped to the section of intermittent fever in The Prescriber by Clark. And what he has given, initially he has mentioned about the disease. He has also mentioned about prophylaxis in the marshy areas, and after that he starts giving the therapeutics. Now in this also he has given very specific therapeutics, and against that he has given one or two remedies that we can give. Out of which, let's see this statement. With gastrointestinal symptoms, the heat preceding or mingling with chills, nux vomica. So in almost every book that you see, in nux vomica, the fever is almost always accompanied by some form of gastrointestinal symptoms. So again, this becomes a sort of a confirmatory reference for the final remedy, that is nux vomica. So now the treatment that was given to this patient was nux vomica 30. Because it was an acute case of fever, we have repeated the medicine 3 times a day, because in acute cases, the more intense the acute disease, the faster the remedy exhausts its action, which is why it needs to be repeated. So here we gave her nux vomica 30 thrice a day and we prescribed it for 3 days. However, we told her to follow up every day with us. On the second day, she reported that the temperature rose at the same time at night. However, fever did not cross 100 Fahrenheit. Chills were present, but not as severe. Painful urination had reduced, although she was still passing scanty urine. So we had to reiterate about her water intake. So if you can see that right from the second day, the fever was on a downward trend. On the third day, chills were absent. She felt feverish at night, although she feels that her weakness has reduced. The nausea is much better. She passed hard stool but with not much strain. Painful urination has almost gone, and now the urine volume has slightly increased. We now reduced the doses of nux vomica 30 from thrice a day to twice a day. On day 4, there was no fever, but we did inform her that she may get fever on day 5, because now we see that the gap between the paroxysms of fever was increasing. There's no pain in urination and urine volume has increased. We continued with nux vomica twice a day. But from day 5, there was no fever and no problems in urination, which means that her acute phase of fever had already passed off. So what is the learning that we take away? What we need to understand right now is that just the acute phase of fever has passed, but we still need to administer an anti-miasmatic so that the problem does not recur, and we also need to address the problem of renal calculi. So, as mentioned by Hahnemann, treat the acute phase of an illness first. This helps to bring the chronic picture to the fore and make the symptoms more clear. Once the acute phase has been managed, a detailed case history and anti-miasmatic remedy is essential to complete the cure. If an anti-miasmatic is not given, the chances of relapse are high. Another learning, which is a very happy learning for us, is that acute fevers can be managed with homeopathic medicines very well. The modalities, concomitants, and trend of the fever in its various stages point us in the right direction to treat the fever. And reference books that are of great use while you're treating fever are Boger Bonninghausen's Characteristics and Repertory, Therapeutics of Fever by H.C. Allen, and Homeopathic Prescriber by Clark. So thank you very much. I hope that you have taken away a lot of learning from this case. I hope that you will have more confidence in your practice while treating acute cases, especially of fevers. Thank you and take care.